thought I'd share a patient who presented with neck pain that radiated into the left intrascapular area. In case this kind of information is useful for people, great. So a man in his 30s presented with neck pain, left greater than right, 90 versus 10%, down into the middle of the shoulder blades. It had started 2 days prior to seeing me. He also noticed some decreased mobility in his neck. And since the initial onset about 48 hours ago was improving, he was concerned because he had also had the same symptoms about 2 months ago. And he hypothesizes that it could be due to more flexed sitting on a couch. He works from home, from a home office, on a chair, and then sometimes on the couch. He did not present with numbness or tingling. He said he gets worse looking down at a laptop and phone. Actually, no, looking down at a laptop or phone he found to be irrelevant, but he would have pain getting up from lying. He felt better walking. It could disturb his sleep. In terms of his mechanical exam, so that was his verbal history, pretty short and sweet because it was a quite acute problem. The pain was present as we spoke. In terms of upper extremity strength, bilateral, upper extremity shoulder flexion, abduction, 5 out of 5, biceps, triceps, wrist extension, thumb extension, 5 out of 5, external and internal rotation of the shoulders, 5 out of 5. The movement exam, which is probably the most important, protrusion, no problem, flexion, no loss. He felt it in the base of his neck, left more than right. Retraction, no problem, no loss, no pain. Extension though, on a scale of no loss to minimal, moderate, or major loss, I marked down that he had a minimal to moderate loss of extension with a mild deviation of his neck to the right. Lateral flexion to the right, no loss. To the left, a tiny bit of loss. Rotation to the right was a minimal loss, and rotation to the left was no loss. I did not do nerve tension testing on this gentleman. So, third part of my exam is repeated movement testing. We started with repeated retraction. We did 8. Did not produce pain, did not change his pain, no effect on mechanics. So I moved to retraction extension of the neck. We did 3 sets of 8. They produced left neck pain or increased left neck pain and didn't make it worse. Afterwards, he felt a little bit better, and he had improved neck right rotation, which is one of his 2 main losses, meaning right rotation and extension were his 2 biggest notable losses in neck mobility. So his home test, his homework became neck retraction and extension times 10, approximately every 2 hours, and we did discuss posture because it made sense that the frequent looking down and deflection would possibly not make him worse, but would impede his healing. I also gave him instructions to add self-overpressure with his hand on his chin in a few days if he was able to tolerate that increased force. He came back 8 days later. He said he was almost 100% resolved. The exercise, if he's feeling symptoms, can relieve it, and that he had decreased his frequency significantly to just once or twice a day since a few days ago because he was feeling so much better, which I find to be, the double-edged sword is if someone's feeling better, they stop with the therapy, but often that therapy is still indicated if signs are still present, even though symptoms have abolished or significantly reduced. So we did discuss that as part of our talk. His movement exam was significantly better. Everything was fine. So extension was normal, no deviation, right rotation had normalized. Everything was fine except cervical flexion, neck flexion still produced mild left tightness in the base of his neck. I pointed out to him that that was still an abnormality, that was still a sign. And so we reviewed his home exercise program. We did 2 sets of 10 with the overpressure going into cervical retraction extension over the chair. His flexion still had some tightness in the left neck. So I told him that he needed to continue with the home exercise program with the overpressure until he could self-test and flexion no longer produced symptoms on the left neck. Clearly they don't produce symptoms on the right neck, so something's wrong if it's on the left. And then I wrote down his program of continue that until that flexion is no longer symptomatic. And then when it's no longer symptomatic, he needs to do a week of both flexion and extension. And then I gave him a handout on lifetime maintenance for the neck, went over the mechanisms, the processes, what to do in an emergency. He was given the Treat Your Own Neck book on day one. So I was happy discharging him then with that plan.